The state is expected to receive a COVID-19 vaccine this month, more than 300,000 doses of it. Joining me now is Dr. Laura Gross with Stanford Health Care. And first of all, how long does immunity last after you get the vaccine?
COVID-19 vaccine is new, so we don't know how long immunity will last. We could expect that immunity will probably last anywhere from months to years. So it's expected that at least 6 months, but it could be years. And once the vaccines are given to people, the FDA is going to continue to study the vaccines and we'll find out how long immunity lasts. But the CDC felt that if it lasts 6 months or longer, that would be acceptable.
So is it known how long it takes for you to be protected from the virus once you get the vaccine?
The studies that were done on the vaccine studied day 7 after the second dose, which for the Pfizer vaccine, the second dose is 3 weeks after the first dose. And for the Moderna vaccine, it's 4 weeks after the first dose. So it looks like people are protected within around 4 weeks after they receive both doses of the vaccine.
If you've already had the COVID-19, should you still get a vaccine?
The short answer to that question is yes, likely yes. The longer, somewhat more interesting answer to that question is that the studies that were done by both the upcoming vaccines by Pfizer and Moderna included people who had COVID-19 in the studies. And so when all the evidence goes to the FDA and to the CDC will look at the evidence, as it always does with vaccines, and make recommendations for people who've already had COVID. But the short answer is yes, if you've already had COVID, it's very, very likely that the CDC is going to recommend that you still get the shot. We don't know how long people who already had COVID, how long they're protected or immune from getting COVID in the future. So getting the immunization will likely protect them moving forward from getting it again.
You know, we hear information day after day about the vaccines. As a medical professional, are you concerned at all the FDA might be rushing through the approvals, or do you trust the process?
I trust the process. The process from the start to the finish is very well laid out and run by top experts, not only beginning with the companies that are making the vaccines have the best experts who know how to make vaccines. And then every step along the way has had an advisory committee that has no skin in the game, looking at all the data, watching the process, making sure that the vaccine is safe and that it works, and that it can be manufactured correctly. So at stage 3, the companies had outside advisory companies calculating and watching the studies. And then now, this is very exciting, as the FDA is reviewing all the information from the companies, the outside advisory committee is also looking at all that data, and they're gonna review it first for Pfizer on December 10th, which I'm super excited about because they're so transparent. It's gonna be live streamed, the meeting where Pfizer actually presents all the data to the FDA and the outside advisory committee. It's called the VRBPAC committee will be presented all that information, and you can log in and watch it. I plan to watch that meeting and listen to all the data myself. But once the FDA approves it, the CDC has to look at it. And then in California, Governor Newsom has also formed his own safety committee that's going to review it again and make sure that it's safe and that it gets distributed ethically. So once all those experts approve this vaccine, yes, I will take it. I will take it myself. I will give it to my parents. I will recommend it to all my friends, all my patients. I'm so excited.
Yeah, I think a lot of people have been waiting for this to come out. When it comes to testing, the FDA recently granted emergency authorization for a Selfswab kit used by Stanford Medicine. Tell us about that.
Yeah, that's going to be another tool for us to use to fight the pandemic. As you know, most people have to get swabbed outside by a nurse, or a provider has to do the swab for you, which is a rate limiting step in getting tested. So Stanford, in collaboration with the Chan Zuckerberg BioHub, created this Selfswab test that has been FDA approved. They showed that, I think they studied like 41 people, every single one of them could swab themselves effectively. Doesn't have to go all the way down the back of your nose. It gets packaged and mailed to people at home and then couriered back to the lab. So companies, schools, nursing homes can all use this without having that rate limiting step of having to have an order and then having to have somebody perform the test for you. So that's just another tool that we can use to fight the pandemic.
All right, so much information to know. Dr. Laura Gross with Stanford Health Care, thank you.
Thank you for having me.